Dr. James Mercer walked through the sliding glass doors of Central Metropolitan Hospital with his usual confidence. The early morning sunlight reflected off his perfectly polished name badge that read, Dr. James Mercer, Chief of Emergency Medicine. He nodded at the reception staff as he made his way to the doctor's lounge. "Morning, Dr. Mercer," called out Nurse Rodriguez. "Morning," he replied without looking up from his phone. James considered himself an important man with no time for small talk. After 12 years at Central Metropolitan, he had earned a reputation as a skilled doctor, though many staff members whispered about his cold bedside manner. The emergency room was already busy by 8 a.m. James frowned at the patient list on the board. Tuesday mornings were supposed to be quiet, but today there were already 8 people waiting. He sighed loudly so everyone could hear his frustration. "I'll take the chest pain in room 3, he announced, ignoring the order of arrival. The nurses exchanged glances but said nothing. In the crowded waiting area, Zara Johnson sat doubled over in pain. The 28-year-old web designer had woken up at 5 a.m. with severe stomach pain that only got worse as the morning progressed. By the time her roommate drove her to the hospital, Zara could barely walk straight. "I think I need to see a doctor right away," Zara told the receptionist, her voice strained. "The pain is really bad." The receptionist looked at Zara's pale face and sweaty forehead with concern. "I'll mark it as urgent. Please take a seat, and we'll get you in as soon as possible." Zara had been waiting for nearly an hour when she saw 3 other patients who arrived after her being called in. She approached the desk again, now barely able to stand upright. "Excuse me, I've been waiting for a long time. The pain is getting worse," she explained, leaning against the counter for support. The receptionist frowned and checked the system. "I'm sorry, Ms. Johnson, I marked your case as urgent. Let me speak to the charge nurse." Nurse Sophia Chen approached Zara after speaking with the receptionist. "Ms. Johnson, I'm sorry about the wait. Let me check your vitals and get you into a room." Sophia's face grew concerned as she took Zara's blood pressure and temperature. "Your blood pressure is quite low, and you have a slight fever. I'm going to get you into a room right now." 20 minutes later, Dr. Mercer finally entered room 6, where Zara lay curled on her side. He glanced at her chart without making eye contact. "Ms. Johnson, says here you have stomach pain," he said flatly. "Yes, doctor. It started early this morning, and it's getting worse. It's on my lower right side end." Dr. Mercer cut her off. "Probably just gas or menstrual cramps. Have you taken any pain medication?" "Yes, but it didn't help. This feels different than normal cramps. I never felt pain like this before," Zara explained, trying to sit up. Dr. Mercer barely touched her abdomen during his examination, pressing lightly in a few spots before stepping back. "Everything feels normal. We'll run some basic tests, but I think it's nothing serious. Probably just need to wait it out." As he turned to leave, Zara called out, "Doctor, it really hurts. Could it be appendicitis or something else serious?" Dr. Mercer looked at her with thinly veiled annoyance. "Let's not jump to worst-case scenarios. Some people have lower pain tolerance than others." His dismissive tone wasn't lost on Nurse Chen, who stood in the corner of the room updating Zara's chart. She noticed how different Dr. Mercer's examination was compared to the thorough ones he usually gave other patients. As Dr. Mercer left the room, he muttered to Sophia, "Run the basic panel, but don't rush it. We have real emergencies to deal with." Sophia watched him walk away, her concern for Zara growing by the minute. She had seen this behavior from Dr. Mercer before, but never so blatant. Something wasn't right, both with Zara's condition and with the doctor's treatment of her. Nurse Sophia Chen couldn't shake the feeling that something was wrong. She watched Dr. Mercer walk away, then turned back to Zara, who was clutching her side in obvious pain. "I'll get those tests started right away," Sophia assured her, patting Zara's arm gently. "Try to rest if you can." Zara nodded weakly, her forehead beaded with sweat. "Thank you. I know something's not right." In the hallway, Sophia approached the lab technician. "Mark, can you rush Ms. Johnson's blood work in room 6? I'm concerned about her condition." "Dr. Mercer just told me not to prioritize it," Mark replied with a frown. "Said it wasn't urgent." Sophia glanced around to make sure Dr. Mercer wasn't nearby. "I'm requesting it as charge nurse. Her vitals are concerning." Meanwhile, Dr. Mercer was chatting with Dr. Peterson by the coffee machine. Got another drama queen in room 6, he said, stirring his coffee. Claims she's dying of stomach pain but probably just needs to take some Gas X. Did you check for appendicitis? Ectopic pregnancy? Dr. Peterson asked. Dr. Mercer waved his hand dismissively. Waste of resources. You know how these people exaggerate. These people? Dr. Peterson raised an eyebrow. Before Dr. Mercer could respond, his pager beeped. Another patient had arrived with chest pain, and he hurried off, leaving his disturbing comment hanging in the air. 2 hours passed, and Zara's condition worsened. Her pain had intensified, and she was now vomiting. Sophie checked on her frequently, growing more alarmed each time. The doctor hasn't been back yet? Zara asked through gritted teeth. I'll find him right now, Sophia promised, her patience wearing thin. She found Dr. Mercer finishing lunch in the doctor's lounge. Dr. Mercer, Ms. Johnson in room 6 is deteriorating. Her pain is worse, she's vomiting, and her fever has increased to 101.2. Dr. Mercer sighed heavily. Fine, I'll stop by when I finish my lunch. Sir, I believe she needs immediate attention, Sophia insisted, standing her ground. Nurse Chen, I've been doing this for 20 years. Trust me, she's fine, he said coldly. Some patients just want attention. 20 minutes later, Dr. Mercer finally returned to Zara's room. He glanced at her chart without acknowledging her obvious distress. Your blood work shows a slightly elevated white count, but nothing alarming, he said flatly. Probably a mild stomach bug. Zara struggled to sit up. Doctor, the pain is getting worse. It's concentrated on my right side now, and I can barely move without feeling like something is tearing inside me. Dr. Mercer's expression hardened. Ms. Johnson, the emergency room is for real emergencies. If you continue to insist something is wrong when all evidence suggests otherwise, you're taking resources away from patients who actually need help. Tears welled in Zara's eyes, both from pain and frustration. I'm not making this up. Something is seriously wrong. I'll prescribe some pain medication, he said dismissively. Take it at home. If you're still feeling unwell in a few days, follow up with your regular doctor. As he scribbled on his prescription pad, Nurse Chen entered with Zara's latest vitals. Her blood pressure had dropped further. Dr. Mercer, her pressure is 90/60ths now, Sophia reported with urgency in her voice. Give her some fluids before discharge, he replied without looking up. Sophia stood her ground. Sir, with all due respect, I think we need additional tests. Her symptoms align with several serious conditions. Dr. Mercer's face flushed with anger. Nurse Chen, may I speak with you outside? In the hallway, he towered over Sophia. Do not question my medical judgment in front of patients. I said she's fine to go home. But sir. That's enough, he snapped. I don't need nursing staff telling me how to do my job, especially for patients who are clearly overreacting. Sophia watched him storm off, her hands trembling with anger. Through the door, she could hear Zara crying softly. Making a decision that could risk her job, Sophia picked up the phone at the nurse's station and dialed an extension. Dr. Paddle, this is Nurse Chen. I need your help with a patient Dr. Mercer is discharging. I believe she's in serious danger, and I don't know who else to call. Dr. Anita Paddle arrived in room 6 less than 5 minutes after Sophia's call. She was known throughout Central Metropolitan Hospital for her kind manner and medical expertise. Unlike Dr. Mercer, she always took time with patients regardless of who they were. Hello, Ms. Johnson. I'm Dr. Patel, she said, smiling warmly at Zara. Nurse Chen is concerned about you, so I'd like to take another look if that's okay. Zara nodded weakly, relief washing over her face. Thank you. No one is listening to me. Dr. Paddle pulled on a fresh pair of gloves and began a thorough examination. She pressed gently on different areas of Zara's abdomen, noting when Zara winced or tensed. The pain is worst here, she asked, her fingers hovering over the lower right quadrant. Yes, Zara gasped. It feels like something's burning inside. Dr. Paddle's expression turned serious. She checked Zara's chart and frowned at the limited tests Dr. Mercer had ordered. Ms. Johnson, I'd like to run some additional tests immediately. I'm concerned about several possibilities, including appendicitis or an ovarian issue, she explained. Nurse Chen will take you for an ultrasound right away. As Sophia prepared to move Zara, Dr. Mercer appeared in the doorway. His face darkened when he saw Dr. Patel. "What's going on here?" "This patient has been discharged," he said sharply. Dr. Patel stepped into the hallway with him, closing the door partially. "James, I've examined Ms. Johnson and believe she needs immediate additional testing. Her symptoms suggest a possible surgical emergency." "I've already ruled that out," Dr. Mercer insisted, his voice rising. "This is my patient." "Then why haven't you ordered an ultrasound or a complete CBC? Her white count is elevated, she has localized pain, fever, and low blood pressure," Dr. Patel countered firmly. "These are textbook warning signs." "You're overreacting, just like the patient," he scoffed. "Some people come in expecting special treatment and—" "This has nothing to do with special treatment," Dr. Patel interrupted. "This is about proper medical care." Their heated discussion was interrupted when Sophia called out urgently from inside the room. "Dr. Patel, she's vomiting again and her pulse is racing." Dr. Patel rushed back inside, with Dr. Mercer reluctantly following. Zara was bent over a basin, her body shaking. "I'm ordering an emergency ultrasound and CT scan," Dr. Patel announced, already writing the orders. "And I want a surgical consult immediately." Dr. Mercer crossed his arms. "This is completely unnecessary." "Then why don't we let the test results decide?" Dr. Patel challenged him. "Unless you're afraid of being wrong." The tension between them was palpable. Finally, Dr. Mercer threw up his hands. "Fine, waste hospital resources. I'll sign off on it since you're so insistent, but this is still my patient." He scribbled his signature on the orders and stormed out of the room. Sophia and Dr. Patel exchanged glances. "Let's move quickly," Dr. Patel said. "I don't like her color." 30 minutes later, the ultrasound technician was pointing at the screen with concern. "There's definitely a mass on the right ovary, and there's free fluid in the pelvic cavity." Dr. Patel studied the images carefully. "It looks like a ruptured ovarian cyst with internal bleeding. We need to get her into surgery now." When Sophia informed Dr. Mercer about the ultrasound results, his response was cold and defensive. "Just prep her for surgery then. Dr. Wilson is on call today." "Aren't you going to at least review the images?" Sophia asked, struggling to hide her disbelief. "I'm busy with other patients," he replied dismissively. "Just make sure Dr. Wilson gets the case." As Zara was being prepared for emergency surgery, the hospital grapevine began buzzing with talk about Dr. Mercer's behavior. Several nurses who had witnessed his treatment of Zara were openly discussing his dismissive attitude and apparent bias. What no one realized yet was that among the daily hospital admissions report that had just reached the hospital administrator's desk was a name that would soon change everything: Johnson, Zara E. And beside it, in the emergency contact field, Williams, Dr. William, relation, father. Hospital Administrator Patricia Morgan was reviewing the daily admission reports when a familiar name caught her eye. She adjusted her glasses and looked more closely at the form. "Zara Johnson," she murmured to herself. "Could it be?" Patricia picked up her phone and dialed an extension. "Sandra, could you pull up the emergency contact information for a patient named Zara Johnson? She was admitted this morning." After a brief pause, Sandra confirmed what Patricia suspected. "Yes, her emergency contact is listed as Dr. William Williams." Patricia's heart raced. Dr. Williams wasn't just any doctor. He was one of the most respected surgeons in the country and, more importantly, the man who had recently purchased a controlling interest in Central Metropolitan Hospital. Few staff members knew about this yet, as Dr. Williams preferred to stay behind the scenes while implementing his vision for healthcare reform. "Where is Ms. Johnson now?" Patricia asked urgently. "She's being prepped for emergency surgery. Apparently, she has a ruptured ovarian cyst with internal bleeding." Patricia thanked Sandra and immediately headed toward the surgical floor. As she walked briskly through the corridors, she wondered if Dr. Williams knew his daughter was here. He was supposed to be at a medical conference in Chicago until tomorrow. When Patricia arrived at the pre-op area, she found Zara lying on a gurney, looking pale and frightened. Nurse Chen was adjusting her IV. "Miss Johnson," Patricia said softly, approaching the bed. "I'm Patricia Morgan, The hospital administrator. I just wanted to check on you personally and make sure you're receiving proper care. Zara looked surprised by the attention. Thank you. It's been a difficult morning. Sophia glanced curiously at Patricia, wondering why the administrator was making a personal visit to a regular patient. Is there anything you need, Ms. Johnson-Williams? Patricia asked, using Zara's full name. At the mention of Williams, Sophia's eyes widened in recognition. Zara noticed a reaction. I go by Johnson professionally, Zara explained weakly. Less complicated that way. Patricia nodded understandingly. Of course. Have you contacted your father? No, Zara shook her head. He's at a conference, and I don't want to worry him. I'll call him after the surgery. As they were speaking, Dr. Wilson arrived to discuss the surgical procedure with Zara. Patricia pulled Sophia aside. What happened this morning? Patricia asked in a low voice. I want the full story. Sophia hesitated for a moment, then explained everything. Dr. Mercer's dismissive behavior, his refusal to order proper tests, and how Dr. Paddle had to intervene. Patricia's expression darkened with each detail. And he never conducted a proper examination? No, Sophia confirmed. It was as if he'd decided she wasn't worth his time from the moment he saw her. I see, Patricia said, her voice now tight with controlled anger. Thank you for being honest, Nurse Chen, and thank you for advocating for Ms. Johnson. That's exactly the kind of care we want at this hospital. After ensuring Zara was comfortable and in good hands with Dr. Wilson, Patricia returned to her office and closed the door. She pulled out Dr. Mercer's file and began reviewing his patient satisfaction scores. She had always found them oddly divided. Some patients gave him excellent reviews, while others reported terrible experiences. She had never looked closely at the pattern before, but now she began sorting the reviews by patient demographic information. A disturbing picture emerged. Meanwhile, the surgery was underway. Dr. Wilson successfully removed the ruptured cyst and stopped the bleeding. In the recovery room, Zara slowly woke from anesthesia to find Dr. Paddle checking her vitals. The surgery went well, Dr. Paddle assured her. You should make a full recovery. Zara smiled weakly. Thank you for believing me. Down the hall, word was spreading among the hospital staff. Whispers of Dr. Williams' daughter traveled from department to department, eventually reaching the emergency room where Dr. Mercer was finishing his shift. Did you hear? A technician whispered to him. That patient you discharged, the one Dr. Paddle took to surgery. Turns out she's Dr. Williams' daughter. The color drained from Dr. Mercer's face. What did you say? Zara Johnson. She's actually Zara Johnson-Williams. Her father owns the hospital now. Dr. Mercer stood frozen, his coffee cup suspended midway to his mouth, as the full implications of his actions began to dawn on him. Dr. William Williams was in the middle of his presentation at the Chicago Medical Conference when his phone vibrated repeatedly in his pocket. He ignored it at first, focused on explaining his new technique for minimally invasive cardiac surgery. But when it buzzed for the 5th time, he politely excused himself and stepped off the stage. 4 missed calls from Patricia Morgan and 1 text message. Your daughter Zara is at our hospital. She's stable after emergency surgery. Please call me ASAP. William's heart pounded as he dialed Patricia's number. She answered immediately. William, Zara is okay, Patricia said quickly, knowing his first concern. She had a ruptured ovarian cyst that required surgery, but Dr. Wilson performed the procedure successfully. She's in recovery now. William let out a breath he didn't realize he'd been holding. Thank God. What happened? Why didn't she call me? She didn't want to worry you during your conference, Patricia had explained. But William, there's something else you should know. As Patricia detailed the morning's events, Dr. Mercer's dismissive treatment, the delayed diagnosis, and how Dr. Patel and Nurse Chen had intervened, William's relief gave way to quiet anger. If Nurse Chen and Dr. Patel hadn't stepped in, Patricia's voice trailed off. I understand, William said, his voice controlled but tight. I'm catching the next flight home. 3 hours later, William walked through the doors of Central Metropolitan Hospital. Despite owning the majority stake, he rarely announced himself when visiting. He preferred observing how the hospital functioned when people weren't putting on a show for the boss. He went directly to Zara's private room, where he found her sleeping peacefully. The sight of his daughter, his brilliant, strong daughter, looking so vulnerable, hit him hard. He sat beside her bed and gently took her hand. Zara's eyes fluttered open. "Dad, what are you doing here?" "Your conference is not as important as you," he finished, squeezing her hand. "How are you feeling, sweetheart?" "Like someone used me for kickboxing practice," she said with a weak smile, "but better than this morning." William's expression darkened. "Patricia told me what happened." Zara sighed. "Dad, don't make a big deal about this. I'm fine now." "It is a big deal, Zara. This is exactly why I bought this hospital, to change how healthcare is delivered, to make sure everyone gets quality care regardless of who they are." His voice trembled slightly. "And then my own daughter." A knock on the door interrupted them. Patricia entered with Dr. Patel and Nurse Chen. "I hope we're not disturbing you," Patricia said. Dr. Patel and Nurse Chen wanted to check on Zara. William stood and extended his hand to each of them. "Thank you both for what you did today. I'm forever grateful." Dr. Patel smiled warmly. "We were just doing our jobs, Dr. Williams. Zara was an excellent patient." "Even when they thought I was just overreacting," Zara added, glancing meaningfully at her father. After checking Zara's vitals and ensuring she was comfortable, Dr. Patel and Nurse Chen left the room. Patricia lingered. "William, I've reviewed Dr. Mercer's patient files," she said quietly. "There's a clear pattern of differential treatment. Non-white patients consistently receive less testing, shorter visits, and fewer referrals to specialists than white patients with identical symptoms." William's jaw tightened. "How long has this been happening?" "The data goes back years," Patricia admitted, looking ashamed. "I should have caught it sooner." "We all should have," William said, his voice heavy with disappointment. "What matters now is what we do about it." He looked at his daughter, thinking about how close she had come to a much worse outcome. Then he thought about all the patients without his connections, without a father who owned the hospital, who had suffered under Dr. Mercer's care. "I want a full ethics committee meeting tomorrow morning," he decided. "And I want Dr. Mercer there." "What are you going to do?" Zara asked, concern in her voice. William looked at his daughter with determination in his eyes. "What I should have done years ago, make this hospital truly equal for everyone, starting with accountability for those who stand in the way of that vision." As Patricia left to make the arrangements, William sat back down beside Zara's bed, his mind already mapping out the changes that would come from this painful lesson, changes that were long overdue. The hospital ethics committee rarely met in the main boardroom. The large oak table and floor-to-ceiling windows were usually reserved for meetings with investors and important guests. But today was different. Dr. James Mercer straightened his tie nervously as he entered the room. He had been dreading this meeting since yesterday when he received the formal notice to appear before the ethics committee. The rumors about Zara Johnson's true identity had spread throughout the hospital like wildfire. 7 committee members were already seated at the table. Patricia Morgan sat at one end with a stack of folders in front of her. When Dr. Mercer walked in, she didn't smile. "Please take a seat, Dr. Mercer," she said, gesturing to an empty chair. As he sat down, the door opened again. Dr. William Williams entered, looking impeccable in a tailored suit. Behind him came a young woman in a wheelchair, Zara Johnson Williams. Dr. Mercer's mouth went dry. He had hoped the rumors weren't true, but seeing them together erased any doubt. The family resemblance was clear despite their different skin tones. Zara had her father's sharp, intelligent eyes and the same determined set of her jaw. "Thank you all for coming," Dr. Williams began, taking his place at the head of the table. "As most of you know, I am Dr. William Williams. What some of you may not know is that I recently became the majority shareholder of Central Metropolitan Hospital with the goal of creating a medical center that truly serves all members of our community equally." His eyes locked with Dr. Mercer's for a moment before continuing. "Yesterday, my daughter Zara came to our emergency room in severe pain. What happened next has forced us to confront some uncomfortable truths about how care is delivered in this hospital." Patricia opened one of her folders. "Dr. Mercer, we've reviewed your treatment notes from Ms. Johnson Williams, along with the reports from Nurse Chen and Dr. Patel. Could you explain your clinical reasoning for denying Ms. Johnson Williams further testing despite her symptoms?" Dr. Mercer shifted in his chair. I made a clinical judgment based on my examination. Her symptoms didn't appear severe enough to warrant. Didn't appear severe enough. Zara interrupted, her voice steady despite her obvious anger. I could barely stand. I told you the pain was worse than anything I'd ever felt. I was vomiting. My fever was rising. Dr. Mercer tried to maintain his composure. Many patients exaggerate their symptoms to get faster attention. Many patients? Dr. Williams asked quietly. Or certain patients? Patricia placed a graph on the table. This shows the rate at which you order diagnostic tests for patients, broken down by race. White patients receive comprehensive testing at nearly 3 times the rate of black patients with identical symptoms. The room fell silent as the committee members studied the graph. Dr. Mercer's face flushed red. That's not possible. I treat all my patients the same, he insisted. The data suggests otherwise, Patricia replied firmly. We've also compiled patient satisfaction scores and complaints. Again, there's a clear pattern. Dr. Williams leaned forward. Dr. Mercer, I'm not here to vilify you. I'm here because what happened to my daughter happens to countless patients every day. The difference is, my daughter had advocates who stepped in. She had a father who owns this hospital. Most patients don't have those advantages. Zara wheeled herself closer to the table. When you looked at me, what did you see? Dr. Mercer, did you see a patient in pain? Or did you just see a black woman you assumed was exaggerating? Dr. Mercer stared at the table, unable to meet her gaze. The truth of her words hung heavy in the air. If Nurse Chen and Dr. Patel hadn't intervened, Zara continued, my condition could have become life-threatening. How many other patients haven't been so lucky? Dr. Williams placed a document on the table. This is our new patient care protocol. It includes mandatory peer review of all cases where standard testing is denied, anonymous reporting systems for staff who witness discrimination, and regular audits of treatment patterns. He slid the document toward Dr. Mercer. The question now is whether you're willing to acknowledge the problem and be part of the solution. The entire room watched Dr. Mercer, waiting for his response. His career, his reputation, and most importantly, his own self-image hung in the balance. The comfortable lies he had told himself for years were crumbling under the weight of undeniable evidence. Dr. Mercer stared at the document in front of him, his mind racing to find a way out of this situation. The evidence against him was overwhelming, yet admitting his bias felt impossible. His entire identity as a doctor, as a good person, was being challenged. These statistics could be interpreted many ways, he finally said, his voice not as confident as he'd hoped. Medicine isn't just about numbers. Dr. Williams nodded calmly. You're right. Medicine is about people. Real people with real pain who trust us with their lives. He pulled out another folder and placed several patient files on the table. These are complaints from patients you've treated in the past 3 years. Would you like me to read them aloud? Dr. Mercer swallowed hard. That won't be necessary. Patricia Morgan opened another file. James, we've worked together for 8 years. I've always respected your medical knowledge, but I can't ignore what these records show. I've never intentionally mistreated anyone, Dr. Mercer insisted, his voice rising. I make quick decisions in a busy ER. Sometimes tough calls are necessary. But those tough calls consistently hurt certain patients more than others, Dr. Williams pointed out. That's not coincidence. That's bias. The word hung in the air like a thundercloud. Bias, the thing Dr. Mercer had always insisted he didn't have. Zara, who had been quietly observing, spoke up. When I was in pain, you looked right through me. You decided I wasn't worth your time or attention. Do you know how that feels? For the first time, Dr. Mercer looked directly at Zara. The hurt in her eyes made him uncomfortable in a way the statistics hadn't. I didn't. He began, then stopped. What could he say? That he didn't mean to dismiss her? The evidence suggested otherwise. Dr. Wilson, the surgeon who had operated on Zara, spoke next. James, I've reviewed the case. Her symptoms clearly indicated a potential surgical emergency. It was a textbook presentation. Which you would have recognized immediately if she'd been white, added Dr. Patel, who had joined the meeting late. I've seen you correctly diagnose similar cases in other patients many times. Dr. Mercer felt cornered. What do you want from me? To admit I'm some kind of monster? I'm a good doctor. I save lives every day. No one is calling you a monster, Dr. Williams said firmly. We're asking you to recognize a blind spot that's hurting patients. We all have biases, James. The real failure isn't having them, it's refusing to acknowledge and address them. The room fell silent. Several committee members nodded in agreement. After a long moment, Patricia spoke. The Ethics Committee has reviewed all the evidence and reached a decision. Dr. Mercer, you are suspended from clinical duties for 30 days, during which time you will complete our comprehensive bias training program. Following that, you'll work under supervision for 3 months with regular reviews of your cases. Dr. Mercer's face flushed with anger and shame. This is my career we're talking about. Yes, Dr. Williams agreed. And these are people's lives, including my daughter's. You have a choice, Patricia continued. You can fight this decision, or you can use it as an opportunity to become a better doctor. The kind of doctor who truly serves all patients equally. Dr. Mercer looked around the room, seeing the resolved expressions on everyone's faces. This wasn't going away. His carefully constructed self-image was crumbling, and he had 2 options: keep denying or start rebuilding. Zara wheeled her chair closer to him. Dr. Mercer, I don't want your career to end. I want you to change. Think about how many lives you could save or improve if you treated everyone with the care and attention they deserve. Her words cut through his defensiveness in a way nothing else had. This woman, whom he had dismissed and nearly harmed through negligence, was offering him a path forward. Dr. Mercer looked down at the patient care protocol still sitting in front of him. With a shaking hand, he picked up a pen and signed his name at the bottom. I'll do the training, he said quietly, and the supervision. Dr. Williams nodded, a hint of respect in his eyes. That's the first step. The hard work comes next. As the meeting concluded, Dr. Mercer realized that his greatest challenge wouldn't be the training or the supervision. It would be facing the truth about himself and the harm he had caused. The journey ahead would be difficult, but for the first time in years, it would be honest. 6 months passed quickly at Central Metropolitan Hospital. The leaves outside Dr. Williams' office window had changed from the bright green of spring to the rich gold of autumn. He stood by the window, reflecting on everything that had happened since that fateful day when Zara was rushed into emergency surgery. The hospital had transformed in ways both visible and invisible. New signs in multiple languages welcomed patients in the lobby. The waiting room now featured faces of diverse doctors and patients on its walls. But the deeper changes were in the hospital's systems and people. A knock on his door interrupted Dr. Williams' thoughts. Come in, he called. Patricia Morgan entered, carrying a thick folder. The quarterly report is ready, she said, placing it on his desk. I think you'll be pleased with the results. Dr. Williams opened the folder and studied the graphs inside. Patient satisfaction scores had improved across all demographics. Wait times were more equitable. Test ordering rates showed consistent patterns regardless of patient background. This is remarkable progress, he said, smiling. How's the staff responding to the changes? Better than expected, Patricia replied. The anonymous reporting system has been especially effective. Staff feel empowered to speak up when they see problems. Dr. Williams nodded, then asked the question that had been on his mind. And Dr. Mercer? How is he doing? Patricia's expression turned thoughtful. That's actually why I came to see you. His probationary period ends next week, and we need to make a decision about his future here. What's your recommendation? Dr. Williams asked. Honestly, he's not the same doctor he was 6 months ago. The training changed him. Having to review his decisions with peers humbled him. She handed him another file. These are his patient reviews from the past 3 months. No disparities in care. Several patients specifically mentioned how carefully he listened to them. Dr. Williams read through the reviews, surprised by the praise from patients of all backgrounds. One comment in particular caught his eye. Dr. Mercer really heard me. For the first time, I felt like a doctor actually believed my pain. At that moment, another knock came at the door. Zara entered, looking healthy and vibrant. A far cry from the pale, suffering patient of 6 months ago. Am I interrupting? She asked. Not at all, her father replied. We were just discussing Dr. Mercer's progress. Zara took a seat. I saw him yesterday in the cafeteria. He asked how I was doing. And? Dr. Williams raised an eyebrow. It was sincere, not awkward or forced. Zara shrugged. I think he's actually changed, or at least he's trying to. Patricia nodded. The bias training coordinator says he's one of the few doctors who continued the optional sessions even after completing the required program. Dr. Williams considered this information thoughtfully. I never expected to fire him. That wouldn't solve the deeper problem. I wanted him to become part of the solution. Which brings us to your other project, Patricia said with a smile. The hospital board approved your proposal for the new healthcare equity center. We can break ground next month. Dr. Williams smiled broadly. This had been his dream since purchasing the hospital, creating a center dedicated to researching and addressing healthcare disparities, training medical professionals to recognize bias, and developing new protocols for equitable care. Have you decided who will direct it? Patricia asked. Actually, I have someone in mind, he replied, looking at his daughter. Zara blinked in surprise. Me? Dad, I'm a web designer, not a doctor. Exactly. You understand this from the patient perspective. And after what you experienced, you've become passionate about changing the system. The center needs someone who can communicate these issues to the public and to medical professionals. Zara was quiet for a moment, considering the offer. I can do that, she finally said. I want to do that. Later that afternoon, Dr. Williams walked through the emergency department. He paused outside a treatment room where Dr. Mercer was carefully listening to an elderly Hispanic woman describing her symptoms in broken English. Instead of rushing or interrupting, Dr. Mercer was patient, asking clarifying questions and truly hearing her concerns. Dr. Williams smiled to himself. One changed doctor meant countless patients would receive better care. Multiply that across an entire hospital, and then across the healthcare system, and real transformation became possible. As he continued his walk through the hospital that now truly served all patients equally, Dr. Williams thought about how sometimes the most painful experiences led to the most important changes. His daughter's suffering had been the catalyst for a revolution in care, a legacy that would help patients for generations to come.